Claire, thanks so much for joining me today. And I know this is a conversation I've wanted to have with you for a long time. Just, I think, to bring more awareness again to another aspect of women's health that, I guess there isn't enough awareness. There's not enough discussion about out there. But I guess just to start us and just to give our listeners a sense of it, would you like to share your own story?
Yes, of course. Thank you for inviting me to help raise awareness of both conditions that aren't heard of, even with health professionals. I was diagnosed in 2016 when I was 43 with Lichen Sclerosus and Vulval Cancer, both conditions I'd never heard of before. So I was quite shocked to get told I had two conditions I hadn't heard of, let alone one being a cancer, and also in the area because I'd never used the word vulva. I'd always used the word vagina or down there or private. So that was like three sort of things to hear that I'd never heard before. But looking back, I had symptoms of lichen sclerosus since about 5. My symptoms back then were constipation and very itchy and sore. When you're that young, you quite often have to sit on the floor when you're like at school reading and for assemblies. And that was when I couldn't sit still because it was so sore and itchy. And I was always called a fidget. I was always told off by my mum and teachers for not keeping still. It wasn't until about the age of about 8 or 9 that my mum started to notice there was something wrong because she could hear me crying in the toilet
Oh,
because I was
bless.
having cuts and tears. As soon as you go to the toilet, the urine just stings like acid. So I would scream and cry. I would say I was fine. I didn't want to go to see a GP. I kept putting her off, and eventually she made me go. I think I was about 9 then. And, she didn't really know what my symptoms were, only the fact that it was painful when I went to the toilet. So we saw a male GP. He never asked to look, never really asked about symptoms from what I can remember. And I didn't say anything because I was quite embarrassed. So my mum just said that, it burns when she goes to the toilet. So straight away he said I had cystitis. So I was sent away with treatment for that, which helped a tiny bit, but not much. But because I was so embarrassed, I just hid it then from my mum. And I didn't want to go back to see a male GP again. And unfortunately that, quite often you only get one chance, doctors, because it is quite a hard condition. Symptoms are embarrassing. You don't always want to go. So by the time you do go, you've only really got that one chance. So for me, that was mine. And because he never looked, he never asked other symptoms, there was an opportunity there to get diagnosed. Because getting older, I got more embarrassed as a teenager and, I didn't want to go. So I did sort of ignore the symptoms and they went away by themselves till my early 20s and then they came back again, but it was just itchy and sore. I used to self-treat. I used to Google and wonder what it was. I used to try Vagisil, Pseudo-Cream, everything you can think of to help. Nothing really did. I did go back to the GP again, 2 different GPs, male GPs in my 20s. And both times, again, they never asked to look. I never said, can you look? Because obviously I was embarrassed anyway. And they said it was thrush, gave me treatment for that, sent on my way. I used it again, a couple of days, maybe helped a little bit, then came back. So I just kept self-treating myself for thrush for many years. I had 2 children in that time. I had to have caesarean sections because of other complications. But again, nothing was ever said. I've had 8 cervical screening, smear tests over those years. All with, now I know, all with classic signs and symptoms of LS. Again, no nurses ever said anything to me. I'm thinking everything's fine because they're looking and, having these tests, you think that it does more than they do. So again, I sort of wasn't that worried. And then again, in my late 30s, it sort of came back quite a bit more and it was really affecting quality of life. So I went back to a GP again, and this time it was a female GP, and she actually was the first one that actually asked to look. And the first one that took a swab. I didn't even know you could take a swab to find out about thrush. That came back as negative, didn't have thrush. So I actually think I probably never have had thrush before.
Yeah.
Because, the only symptoms of thrush I had would have been the itching and burning. So I don't think I did have it. She then sent me off for blood tests, thinking maybe it could be diabetes related. Again, that came back clear. So she just sort of shrugged her shoulders and said, don't know, it could be early menopause, and just sent me on my way. Never even gave me any, help for if it was early menopause symptoms, which it wasn't, but, no help even still. So again, off I went, carried on using what I could to try and help. I then noticed I had a tear, which is the same area you have when you have a baby and they tear. So I thought, oh, it'll heal by itself. But it didn't. I had that for a good year or two. Again, I even had a smear test when I had, we believe I had cancer at the time and it wasn't picked up. I had smear test, everything was fine. So I'm thinking it can't be anything serious because that would have been picked
Mm.
up in that. And then in the January of 2016, I noticed that the tear had changed. It had gone into like an ulcer. And I thought, oh, I don't want to go back to the GP again. I just keep saying it's thrush, and I just didn't go. And then within 3 months, it doubled in size. It got so painful that I just couldn't sit. So I thought, I'm going to have to go back again. I saw another female GP. She again asked to look, and she said it was herpes. And I was quite shocked by that because, I've been with my husband at the time 25 years. She told me to go to a gum clinic, which I wouldn't have done. So if I had gone with that advice and gone home, I wouldn't be here today. But luckily she saw the sort of shock on my face and she looked again and said, actually, it could be something called vulval cancer. I'm going to send you for biopsy, 2-week pathway. Then she looked at me and goes, please go. If you don't get an appointment in that 2 weeks, please come back. So that was quite scary, getting told that.
Yeah.
So luckily, I was sent for biopsy within 10 days, and within a couple of weeks, I was called back in and was told then that I had obviously vulvar cancer and lichen sclerosus. Because of how long it had been left, it had managed to spread. So I had stage 3 vulvar cancer. During 14 months, I had lots of treatments. I won't go into all that now, but I've had 5 surgeries. I had radiotherapy twice. Again, all the side effects have been life changing. Put me into instant menopause as well, so having to deal with, all those symptoms all at once at 43, as well as the vaginal atrophy and lymphedema of the genitals, all obviously making that area, 3 times worse. But dealing with all that and seeing how easy I was misdiagnosed and how many chances over those years
Yeah.
that I had to get a diagnosis. But I found out the nurses aren't trained in vulva conditions, and yet they got to look at the vulva to get to the cervix. A lot of GPs unfortunately don't get great, training in women's conditions and might not, they think quite often you're too young to have both vulval cancer and lichen sclerosus, but this too young needs to be taken away because you can be any
Yeah.
age for it. Just because it's more common in the older age, it doesn't mean it's not going to happen, because it does.
Yeah.
So because of all that, I suppose, it just made me so angry that no one's heard of them. People getting misdiagnosed. I'm not the only one that's been misdiagnosed, especially with lichen sclerosus. So I wanted to do more. So, I do things like this, try and raise awareness. We have support groups, just trying to get, more people aware and to check the vulva like we're
Yeah.
told really to check the breast.
I think, Claire, it's through you and Jane Lewis actually that I probably got into the whole habit of doing the monthly vulva check, and it is something I've talked about and encouraged people, to get into that because we're very conscious about doing the breast check, right? But we don't tend to, and I think we often shy away from actually even just looking at the vulva, whereas it's so important to do it, isn't it?
It is
So
because it
just
really, you need to know what it looks like so that you
yeah,
know what the
when
changes
something
are for you.
changes.
Yeah,
Yeah,
because obviously I never really looked. So when I did, I had all the symptoms, which I'll go through in a minute, but because I didn't know what vulvas really look like, because it's not something that you see often, let alone your own. So I didn't
yeah,
know that wasn't right. I didn't realise that I shouldn't be that white, or I shouldn't have, so much changes happening.
yeah,
And because of that, I wasn't aware what was going on. I just didn't really look. I knew I had
yeah,
some eye tears or I had like blood blisters and things, but that was through scratching. So, I wasn't really aware that the signs I already had were so obvious of lichen
yeah,
sclerosus and changes. So that's why, yes, it's important to get to know your normal and then just check monthly. And then
yeah.
anything that is not normal for you, get checked out.
And do you think you had the lichen sclerosus back when you were five and
Yes.
six?
Yes, talking to doctors about it. Yes, I had all the classic symptoms, and by the time I was diagnosed, how bad it had got. Because the symptoms can be. You don't have to have all these symptoms. That's where a lot of doctors and us think we haven't got it. The most common are itchy and white, sort of silvery skin, thickened patches. We don't have to have those. They're just the most common ones. But I had
Okay.
white. My whole vulva was white and silvery, thickened patches. I had tears. I had blood blisters. I had small fistures. I had clitoris was buried by this time. I'd lost half my labia. So all those changes, I wasn't aware because I wasn't looking and didn't realise
Yeah.
what it meant to look like that. Yet all those doctors, nurses, had 2 children, had seen it. Surely they would have
Yeah.
thought that doesn't look right. But again, they're not trained, so they're not aware.
Yeah. Gosh, that's from such a young age, like having that at 5 and 6, and feeling like that constant burning. I mean, that must have been so difficult. So
It was.
difficult.
They're realising now, because they say it isn't as common, obviously, in children, and they often used to say that you can grow out of it, which can happen. But I think what they're thinking now is you don't necessarily grow out of it; it just goes into remission, a sort of
Dormant
teenage years.
or okay.
Yeah, and then maybe comes back later on. They're still not 100% sure whether it's autoimmune or not. They think it is, but they think it could be hormone linked, also trauma linked as well. So it's not a great deal of research has gone
Okay.
into the process to know exactly what it is. But when people are diagnosed, they are normally menopause age, which is why it's most common in menopause age. But I've always believed that it's because it takes that long to get diagnosed. You know, it's maybe it takes that long for you to actually go take yourself to the GP because you're older and
Yeah.
you're more aware of your body, or you're more confident in telling the doctor, or because you are older now and you're talking about menopause symptoms, maybe that's how it's talked about and you end up getting diagnosed. But I just
Mm.
think it's just, there are more and more in our group now that are joining that are in their 20s, 30s, 40s, and all those that are diagnosed much older, they look back and think, actually, yeah, I've had these symptoms for many years like me. So
Yeah.
although it's more common, it's more commonly diagnosed, I believe, in the
Okay.
older woman, but not
And
necessarily only affects children and older women. It's just any age. It can just, like you say, go into remission.
yeah.
Different things cause it to flare. What you do, what you use, stress. So it's going to be different throughout your life anyway.
And is there any stats around it in relation to how many women are impacted in the UK, or is it
Yeah,
tracked?
again, that changes. Some have said 1 in 100 women. Some have even said 1 in 30 women. The problem is it's
Okay.
just not recognised, is it? It's an
Right.
unrecognised condition. It is classed as a rare condition, but many
Okay.
doctors now are saying it's not rare. It's just rarely diagnosed,
Yeah.
and it's misdiagnosed as well, and probably a little bit more so now because of all the awareness that sorry, my doorbell going off, because of all the awareness of menopause that we're getting. Um,
Yeah.
People are getting misdiagnosed now as vaginal atrophy when it's actually lichen sclerosus because the symptoms are similar,
Okay.
and vice versa.
Okay.
And also, you can obviously many have both. I have both now, so I
Yeah.
think because more are getting diagnosed now, because I think more, luckily, our GPs are getting more training or more knowledge in menopause side of it. I think they're starting to talk more about vaginal atrophy. That I think more are getting diagnosed.
Yeah. And do you think for any, let's say you start, and I hope anyone listening does start to do a regular self check, vulva self check. So Claire, what are you looking for? What are you looking for when you do that check?
Well, for lichen sclerosus, really, you're just looking for any tears that don't heal, any lumps, ulcers, skin colour changes. It's not normally red. Red is normally it's because it's something else, vaginal atrophy, or could be you've got thrush, or it could be dermatitis, or it could be something you're using is causing the redness. It's not normally red. If it's red, it's because you're rubbing, scratching, whatever. So it's really white, thickened skin areas. It can be in the anal area as well, so it can be around there. Tightness as well. The vagina opening can get tight sometimes. The clitoris can become buried as well and become less sensitive, some even more sensitive. There are quite a lot of symptoms. If
Okay.
and you don't have to have all of them, all the common ones,
Yeah.
because some are obviously asthmatic anyway and don't have any symptoms and get diagnosed by accident because they was having a biopsy for something else. So it's
Okay.
just really getting to know your normal, and anything that's there that
Yeah.
wasn't there before and is still there after 2 to 3 weeks, then just see a doctor. When it comes to vulvar cancer, again, there are similar symptoms. They quite often are a lump, an ulcer, a sore patch. These are all things that are still there after a few weeks. Some get itching, some have bleeding, although it's not necessarily internal bleeding, it's bleeding from the vulva area. but they're not sure where the bleeding's come from because you just obviously see it on the tissue paper mainly. But not everyone does get any bleeding. But again, it's just anything that's not normal for you. And quite often lumps can be cysts, but it's still worth getting it removed or biopsied
Yeah.
because, the youngest we have in our support group, vulva cancer, is 17. She was diagnosed with it at 17. And in the UK, the youngest, according to cancer research, is 0 to 4 years old. So someone's been diagnosed in that age bracket in the UK.
Oh
So that's why
gosh.
you can't. Yes, it's extremely rare, but it
Yeah.
still could happen. So don't
Yeah.
ignore that. That lump. If it's there, just get it removed. Because it
Yeah.
might not be a cyst. It might be vulva cancer. Because although lichen sclerosus was what caused my vulva cancer, there are several types of vulva cancer. So I had squamous cell carcinoma, which is the most common one. But there are others that aren't linked to lichen sclerosus. They are HPV related, so you get precancer cells, or there could be melanoma of the vulva. So there are several types. So they're not
Okay.
all associated with lichen sclerosus, but those that are diagnosed that have lichen sclerosus, not all the time, most of the time it's like me, they didn't even know they had lichen sclerosus. So their lichen sclerosus was left untreated for so many years that it had more of a chance to turn into cancer.
Oh, okay. So that can it can be that happens, that if the lichen sclerosus is untreated, it can develop into cancer.
Yes, again, the stats on that are anything from 2 to sort of 7% of those with lichen sclerosus, it can go on to cause vulva cancer.
Okay.
Research was proven in 2016 by an Australian dermatologist that using regular steroid treatment, which is the gold standard treatment for lichen sclerosus, can lower the small cancer risk if you use it
Okay.
regularly. So once you get your symptoms under control using a potent steroid, then to continue to use regularly to help stop the flares, stop and slow down progression and to lower the cancer risk. The UK, actually, which I'm involved in, the Pearls trial, which is a new trial starting now in the UK, which will take probably about 5 years now before we get all the results from it all. But they've got 2 arms, one where they've got patients with lichen sclerosus that will be using steroids only as and when they have a flare, and the other
Yeah.
group will be using it as maintenance to see, again, what's best.
Oh, very
So
good.
we'll have results from that as well. But at the moment, most dermatologists will say to use steroids regularly. It can be different frequency and strength depending on what your symptoms are. But it's just, there was a research paper out recently saying those that were diagnosed with vulva cancer due to lichen sclerosus, that to carry on using steroids after the recurrence of vulva cancer is lower. So again,
Right.
that's proving that steroids are helping.
Yeah.
So you just have to make sure that you're using the right one for you, because there are quite a lot of steroids.
And did you say your treatment for the vulva cancer that put you into instant menopause?
Yeah, because I had pelvic radiotherapy. So straight
Okay.
away, it was within weeks, and they didn't warn me of that actually. They said there was a risk of lymphedema, which I ended up with, but didn't mention menopause. So I actually thought for a little while that my cancer had come back, because all the symptoms I was getting just all hit me all at once.
Okay.
So
Yeah.
it was quite scary, really. And when I went to see my specialist nurse, she straight away said that sounds like menopause. So I was referred, luckily, and then put on HRT, and that made a big difference straight away. So it's just, again, those with vulva cancer that have treatment which can cause early menopause aren't always told, so they're suffering a bit longer than they need to be.
And I think like we'd see a lot of that in terms of, many women who go for surgery and it results in early menopause. Now it is improving, but we've a lot of work to do yet in terms of just understanding that, you come out of that surgery, if your ovaries have been removed, and it will, you are then into cliff edge menopause. And I always kind of say, spontaneous natural menopause. And I know it can be challenging, but it's far less challenging than going into early menopause because of the intensity of the symptoms.
Yeah,
Was it then that the vaginal atrophy kicked in, or had that already started, the vaginal dryness?
it's hard to tell. Really. I think I was, obviously, because meeting yourself and Diane on Instagram, I didn't realise how many symptoms there were to menopause.
Just a
Obviously, I
few,
had been
just a
a few,
few.
and just maybe your periods might stop and a bit of a hot flush. But yeah, so I wasn't aware of how many symptoms there were. So it wasn't until that I'd done Diane's checklist, and I actually got my husband to tick it as well, because I think someone close to you can see symptoms and signs that you can't. And he
100%.
did, yeah, he did tick the mood one about 6 times. But yeah, but I didn't even put that together really with vaginal atrophy and the symptoms, because it was hard, because obviously I've had pelvic radiotherapy, which damaged my vulva and my skin. I've had all those surgeries. It also caused lymphedema in that area. So yes, now vaginal atrophy, and obviously, the rest of the menopause symptoms. It's hard to tell what's doing what. So I just literally treat them all with what I can, and hope
Yeah.
for the best. But it's hard to tell what symptoms are what sometimes.
And does that impact, all of that in the pelvic area? Does that impact in relation to sexual health? Like, have you found would you have, vaginal dryness? You can have spotting, painful sex. Would that have been more acute for you, or was it the case at all?
Yes, because again, with even having pelvic radiotherapy, actually shrinks the vagina channel anyway. So you're given dilators and lubricants to help with that anyway. So yeah, so it's a big impact. It just just here today, for example, I'm sitting. I've actually used Instagel, which is a numbing cream, because I know I'm going to be sitting for up to an hour. I've been too much discomfort, not just for the vaginal atrophy, but lichen sclerosus. Obviously, I had recent surgery just last year on the vulva, because unfortunately my cancer did come back. So all that together, it's just, everyday life is just difficult. Just walking, sitting, and when you've got obviously multiple things all aimed at the same area, it is
Yeah.
difficult and it impacts. It's just trying to find, what treatments work for you. I was given obviously Vagifem to start with, and then obviously my GP unfortunately didn't want to give me the cream as well to apply to the vulva area, because his words were, I don't want to give you breast cancer. So luckily I knew that wasn't true from
Yeah.
following all you on Instagram. So I had to trick him really and say that I didn't want Vagifem anymore. I wanted to use the cream to insert, so then I could insert and apply outside without his knowledge. So I just done that, and that improved straight away. So it proved it worked.
And it's frustrating, and it's annoying, Claire, isn't it, that kind of, you're bringing that self-management on yourself, because we still need more awareness across all
Yeah.
medical spheres
Yeah,
in
it's
relation to
exactly
so
the same
many
with
aspects.
lichen sclerosus as well, because even lichen sclerosus treatment is steroid cream. But quite a lot of doctors, you could see a GP, gynecologist, dermatologist, and you can all get told slightly different with all of them. So again, that's something that I'm in the process of doing something with some researchers and some doctors to get a website together which gives all the correct information for LS on,
Brilliant.
both for health professionals and for us, so that we're all getting the same information and all told the
Yeah.
same. Because it's so confusing, especially support groups are great. But, when you're getting told, oh, I'm only told to use it once a day, I'm told to use it twice a day.
Yeah.
And,
Yeah.
even long information about steroids, because, lichen sclerosus isn't the same as eczema or psoriasis. But because of a lot of GPs are only aware of those skin conditions, they tend to treat LS similar to that, where you can't, because it's different. So, so trying to get information, it's hard. And, raising awareness and seeing actually, it has made me realise how bad women's health is and the information that we get.
Yeah. Oh God, we could chat for hours on that one, couldn't we? I think, look, it's simply appalling. Like, when there's so many conditions that need more awareness drawn to it, and I think that's where we've got to keep. This is why all the advocacy work that so many people are involved in is so important, to draw attention.
When they're classed as rare as well, that makes it harder, because people aren't interested because they are rare. Same as
Yeah.
money. You can't get money for research because they're rare. But lichen sclerosus now they're saying isn't rare, but it's not talked about enough, because obviously it's embarrassing as well. So
Yeah.
you've got people that they find out eventually, after telling family and friends they have it, that their family and friends have got it. But because they've not discussed it, they don't know. And
Yeah.
when they finally decide
Yeah.
to talk about it, they realise somebody they know's got it. So really, it's this, hopefully both lichen sclerosus and vulva cancer will be like breast cancer is now, and that is just talked about and awareness all the time. But, until we all talk about it, it's not going to happen.
And I think it is that, like, we see a lot here about, doing your breast check, your self check, etc. We don't see it around the vulva, doing that monthly check. And, even just talking to you today, it's a reminder. I really need to go back onto Instagram and remind people again of why it's so important. I mean, you're talking about 2 minutes,
Yeah,
just maybe lie back in the bed, put your foot up on the toilet, use a mirror, and just become familiar with the vulva, which is the external part, and just so you know what it looks like, and so you
yeah.
can see those changes when they
Yeah,
happen.
it's frustrating because there's so many opportunities to raise awareness, whether it's NHS or or doctors, but they don't. It's when you think about cervical screening, they do a smear test and they do campaigns about it, and
Yeah,
yet they don't include all. And now it's even changed. Now it's a HPV test. So there's several HPV cancers, including vulvar cancer, and they don't mention it. And yet
yeah,
it's just easy awareness. Even with the letters that go out, just having the information of the other cancers would be helpful
yeah,
so that you've heard of them and know of them, but they're not. I've spoken to NHS England and they're not interested. It's just it's rare and it's all about cervical cancer, but it's just frustrating. There's so many chances to raise awareness of vulvar cancer or lichen sclerosus with different skin conditions, for example. They don't help when they're talking about skin conditions or talking about skin cancer. Vulvar cancer is a type of skin cancer, and they
mm,
still don't include checking your vulva. Even the NHS or doctors, they put up posts about parts of the body to check for skin cancer, but they miss out the vulva. And
yeah.
yet, vulvar melanoma, as well as vulvar cancer, it's so frustrating that there's ways that it could easily be added to awareness, and it just goes over the head. It's rare that they don't care. So that's what I find frustrating.
And it could be a simple step, couldn't it,
Mm.
when you're having your smear, that it becomes just the step before the smear, that the check is done by the nurse or whoever is performing it, just to see is there anything different. And I think then again, I think a key part of that, Claire, is it's back to us being empowered and informed, that we actually know, okay, just at a minimum, I'm just going to get used to looking so they understand what my vulva looks like.
Yeah.
um, I know you mentioned that the vulva cancer came back, and was it the same, or did you have to go through the same
Yeah, it was.
treatment again?
Yeah, it was a different side of the vulva. So my cancer, the tumour, was in the perineum, which for those that aren't aware, that's sort of 6 o'clock, sort of a clock right at the bottom, in between your your vagina entrance and your anal. So in that gap there is a perineum. That's where my tumour grew. So that was partially removed, and then it came back, but on the other side.
Oh,
So it was first. Luckily, I am seen regularly by a consultant dermatologist. I didn't like a patch area, and so she sent it off for biopsy, and it came back as dVIN, which is pre-cancer, which is
okay,
associated with lichen sclerosus, so not HPV linked, but lichen sclerosus linked. So they want to and remove it straight away, because when it's dVIN, it's an 80% chance of turning to cancer, whereas usual VIN, which is the pre-cancer, can take up to 10 years or not at all. So whereas dVIN is, within 2 weeks I was sent in and the area was removed. They ended up taking more than they needed to, because I think he was a bit concerned. So he did take quite a bit in the end, and luckily he did, because they then found cancer. So they did get clear margins on the cancer, but unfortunately not the dVIN, because it started to go inside the vagina, so he didn't go that far. But so
yeah,
it was left this time to just heal naturally, secondary intention. So they didn't stitch or anything. So that was really hard. It was about 3 months of it
oof,
leaking. It was hard going, but I knew it was the best option for me, because having skin grafts or stitches would have made the area too tight. And now,
yeah,
even before, whenever I sit down, I can split open, because it was stitched before, so this time it wasn't. Also, it's
yeah,
easier to spot any recurrence, because I haven't done any skin grafts or anything. So I knew it was a good way for me. But it was, yes, it was hard. It was 3 months of hard healing, but that's healed now. And just recently,
great.
actually, I had my MMR and CT scan and was given the all clear again.
Oh,
So
brilliant. Oh, I'm so
touch
glad to
wood,
hear that.
my first year of remission once again, and hopefully. But he did say that that was my fifth surgery, and he did say that it probably won't be my last. So
Okay,
it's not in. If it comes back, it's more when it comes back. So it's just
Okay.
being vigilant. I am seen every
Yeah.
3 to 4 months. So hopefully it'd be caught early enough to be removed again.
Yeah, well, that's good. You're kind of having that oversight. And just on that, so say you have someone who, maybe they find that there's something not right, and I don't know, let's say they feel that maybe they don't want to talk to their GP, or maybe that they feel their GP isn't as informed as they like them to be. What other steps is it that you go to a dermatologist, or what would you recommend?
Well, normally your first
Gynecologist?
step, yeah, normally your first steps are to go to your GP. I know it's really hard at the moment, especially in the UK, to get an appointment, but you have to persevere. If you're having problems, speak to the practice manager. Just get an appointment with a GP. If you're
Yeah.
not confident in what they say and what they do, then just say you've got the right to be referred to a specialist, which normally is a dermatologist,
Okay.
hoping that it's a consultant dermatologist so they know more. There aren't many vulva clinics in the UK. The waiting list is extremely long. Up to a year, even longer, because obviously you've got dermatologists to see and those with skin cancer as well, so they get priority. So it's making the lists even long for them as well. So there is a long list. So hoping that you get a GP that knows and has done their training on lichen sclerosus, then you can see them and they can check you. You can see them, make an appointment yourself to see them regularly if you need to. They would give you steroid cream, whatever. If it's something else where they're not sure about and they want to send you off for a biopsy, that would be the 2-week cancer pathway rule, which is slightly longer than that mostly now. But then you're sent off and you normally see gynecologist, could be a dermatologist, who will then do a biopsy. If it is difficult to see your GP and you're having symptoms, especially of lichen sclerosus, then you can go to a sexual health clinic. Quite often they're quite knowledgeable of lichen sclerosus and again can refer you and they can help as well. But it's just about advocating for yourself, really. You've just got
Yeah.
to you just got to accept that the symptoms aren't going away. You need to be seen. Unfortunately, the same as menopause. A lot of people going private and looking in their area and finding a consultant dermatologist that knows a lot about lichen sclerosus and are going down that route. But even that's taking a bit longer now because more are going private. But if you can afford to save up to see one to start with, just make sure you do your research and make sure because you can now with Google you can find out their clinics and what they do, what they specialise in. And then maybe if you can afford to go down that route, it's normally around about £200 for the first consultation, and then you can be referred then NHS after that. But yeah, just please don't ignore the symptoms first of all.
Yeah.
See your GP. If you're not happy with their response, or any doctor's response, get a second, third opinion. Just keep on doing it because if I maybe persevered more, if I'd told the doctors to even look, I might have been diagnosed a lot earlier than I was
When you're
and wouldn't be in the situation that I am today.
Yeah, it's a hard one though, isn't it? Because like when you're so young, it is, and like I would see even women who are in their 50s and they find it difficult to have a conversation with their doctor about vaginal dryness. So, I mean, look, all we can hope with Claire is that all the conversations that are now happening will help people, will help women to feel more empowered that they can have those conversations. And I think, as you rightly said there, it is pushing for the conversations here in Ireland. Your first step is most definitely your doctor. And I think as I always say, look, your doctor it has to be a collaborative, supportive relationship at any stage in your life, but it becomes so crucial from perimenopause on. And, if you feel that that's not the case, well, that's really where you just need to look at that relationship and is that doctor right for you. But really then your referral tends to be from the doctor to a dermatologist, etc. So like anything, there's always waiting lists, whether private, public, obviously public way longer. But I think the most important thing is knowing what the symptoms are, doing that self-check and advocating for your own health is so
Well,
powerful.
there's help out there as well. So obviously there's our support group. There's also the BG, which is either doctors can join and become a member to get training and help, as well as there's stuff on their website as well. If you go on
I'll
my
put all the
website,
details. Yeah, I'll put all the
so
details in the show notes.
there, yeah, to find stuff.
Yeah. I'll
So you
put
can
I'll put
as well.
I'll put any details in the show notes so that people can look at it and kind of check, follow your own page on Instagram and whatever other platforms, and hopefully keep us abreast too of the website that you're working on. That sounds fantastic.
Yeah,
So let me know about that when it comes up, and we'll definitely share it.
great. Thank you.
Claire, thanks so much for sharing your journey, and thanks for the amazing advocacy work that you are doing, because I sometimes feel you're a lone ranger in a kind of a quiet terrain, which I totally get. I think myself and Diane fully understand that one in terms of the menopause space. But now, there's much more conversations about women's health, and we just need that to continue and to keep growing. But thanks so much for joining me today.
Thank you, Catherine, for helping to raise awareness as well.